This video is provided for doctors and healthcare professionals. Other consumers should consult their healthcare provider for placement. The PEG tube CRB management system should be installed 5 to 7 days after surgery. This is the kit we will be installing. It has forceps that won't crush the tubing, a clean, non-sterile bolster that is designed to install over a sterile gauze pad, a silicone retainer sleeve, a special pouch, and tape. As you can see, the low-profile bolster is less than half an inch high. The pouch with opposing baskets holds all of the tubing, making the product virtually hidden under clothing. Now we will install the system. Begin by gently tugging the feeding tube in order to lift the existing retainer, just enough to allow the forceps to clamp the tube between the existing retainer and the sterile gauze pad. The specialized forceps are designed to be fully closed without damaging the feeding tube. With forceps secured, remove the syringe fitting. Remove the existing retainer while carefully keeping thumb pressure on the forceps. Be certain to test that as you pull on the existing retainer, that you are pulling against the forceps and not the internal retainer. Once you get the retainer off, then you will take the end of the tubing and you will cut a diagonal slice in the end of the existing feeding tube. This will aid in getting the new bolster onto the feeding tube. Now, slide the bolster flat side first onto the tube and slide it all the way to the forceps. It should go on quite easily. Once you get the bolster on, you should position it so that the tubing will be facing the pouch. Now you pull, squeeze, and snap the feeding tube into the slot in the bolster to achieve a 90-degree controlled radius bend. This holds the tubing down without collapsing or restricting liquid flow. Now slide the silicone retainer sleeve onto the feeding tube. The retainer sleeve doesn't always slide easily, as it is meant to stay in place, holding the bolster secure once installed. Make sure to slide it snug to the bolster. Now cut the diagonally sliced end of tubing off so that it is flat on top again. Now reinstall the syringe fitting. Remove the forceps. This completes installation of the CRB bolster. Now for installing the pouch. First, prepare the 3M Metapore number 2961 tape. The 3M tape is perforated every 2 inches. You'll want to tear off 2 4-inch pieces of tape. Each piece will have 2 sections. We have done a lot of research on the best tape to use and find this holds fast through several washings, but comes off easily when needed. Apply the first piece of tape to the upper double-looped tape platform. You can see that there are 2 of these, one on the top and one on the bottom. Place the tape so that it is close to the edge of the pouch. Now lift the pouch and apply the second piece of tape to the lower double-looped tape platform. Place the pouch so that the elastic tie down for the tube is approximately 2 to 3 inches away from the CRB bolster. Make sure it is secure to the body. Now tie down the PEG tube with an over-under knot. The elastic must be pulled tight to keep the tube from backing out of the pouch and straining the bolster. The feeding tube is then coiled left and right into the pouch until it is all tucked away. The pouch has been specially designed so that the top and bottom double-looped hinged platforms hold the pouch at the center so any pull or tension on the tape will be minimized. Tape and tie down don't need to be removed for feeding. This allows greater ability for patients to enjoy everyday activities and functions as this creates a secure taping. Advantages: tubing bent and held at bolster will not collapse. Supplied forceps won't crush tubing. Bolster holds tube close to body for security, discreetness, and comfort. Pouch contains all of the tubing. Special tape platform creates strength and flexibility. Easy feeding, no untying or removal of pouch. Strong tape holds the pouch through several washings. Tape removes easily when needed. Bolster can be tightened or loosened. Silicone retainer sleeve keeps bolster snug. Installs in minutes. Thank you for watching. Visit us at www.managedfeedingtubes.com.